Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about endometriosis. In particular, I'll cover what is endometriosis, how you treat endometriosis, and how you can live with endometriosis more successfully. So, we start with what is endometriosis. Endometriosis is an often painful disorder in which tissue that normally lines the inside of the uterus, the endometrium, grows outside your uterus. Endometriosis most commonly involves the ovaries, bowel, or the tissue lining your pelvis. Rarely, endometrial tissue may spread beyond your pelvic region. In endometriosis, displaced endometrial tissue continues to act as it normally would. It thickens, breaks down, and bleeds with each menstrual cycle. And because this displaced tissue has no way to exit your body, it becomes trapped. The surrounding tissue can become irritated, eventually developing scar tissue and adhesions, which is abnormal tissue that binds organs together. This process can cause pain, sometimes severe, especially during your period. Fertility problems also may develop. Fortunately, effective treatments are available. So the symptoms. The primary symptom of endometriosis is pelvic pain, often associated with your menstrual period. Although many women experience cramping during their menstrual period, women with endometriosis typically describe menstrual pain that's far worse than usual. They also tend to report that the pain has increased over time. Common signs and symptoms of endometriosis include painful periods with dysmenorrhea. Pelvic pain and cramping may begin before and extend several days into your period and may include lower back pain and abdominal pain. Pain with intercourse. Pain during or after sex is common with endometriosis. Pain with bowel movements or urination. You're most likely to experience these symptoms during your period. Excessive bleeding. You may experience occasional heavy periods or bleeding between periods. Infertility. So endometriosis is first diagnosed in some women who are seeking treatment for infertility. Other symptoms. You may also experience fatigue, diarrhea, constipation, bloating or nausea, especially during the menstrual periods. The severity of your pain isn't necessarily a reliable indicator of the extent of the condition. Some women with mild endometriosis have extensive pain, while others with advanced endometriosis may have little pain or even no pain at all. Endometriosis is sometimes mistaken for other conditions that can cause pelvic pain, such as pelvic inflammatory disease or ovarian cysts. It may be confused with IBS, a condition that causes bouts of diarrhea, constipation, and abdominal cramping. So the causes. A process called retrograde menstruation is a likely explanation for endometriosis. In retrograde menstruation, menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. Retrograde menstruation alone may not cause endometriosis, though instead the condition may develop when one or more small areas of the abdominal lining turns into endometrial tissue. This is possible because the cells lining the abdominal and pelvic cavities are descended from embryonic cells with the potential to specialize and take on the structure and function of endometrial cells. So what activates the potential remains unknown. So next is, how do you treat endometriosis? First, we look at pain medications. Your doctor may recommend that you take an over-the-counter pain reliever, such as ibuprofen, to help ease painful menstrual cramps. However, if you find that taking the maximum dose doesn't provide full relief, you may need to try an alternative treatment approach. Next is hormone therapy. Supplemental hormones are sometimes effective in reducing or eliminating the pain of endometriosis. That's because the rise and fall of hormones during a woman's menstrual cycle causes endometrial implants to thicken, break down and bleed. Hormonal therapies used to treat endometriosis include hormonal contraceptives, gonadotropin releasing hormone agents and antagonists, and danazole, methylprogesterone, which is Depo-Provera, and aromatase inhibitors. hormone therapies aren't a permanent fix for endometriosis. It's possible that you could experience a recurrence of your symptoms after stopping treatment. And also we have surgery. So surgery can be used. If you have endometriosis and are trying to become pregnant, surgery to remove endometrial implants may increase your chances of success. If you have severe pain from endometriosis, you may also benefit from surgery. And also there's hysterectomy. In severe cases of endometriosis, surgery to remove the uterus and cervix. And finally, we look at how do you live with endometriosis. If your pain persists or is finding a treatment that works takes time, you can try measures at home to relieve your discomfort. Warm baths and a heating pad can help relax pelvic muscles, reducing cramping and pain. Left undiagnosed or untreated, endometriosis can be a frustrating condition. Painful periods can cause you to miss work or school and can strain relationships. Recurring pain can lead to depression, irritability, anxiety, anger, and feelings of helplessness. Infertility linked to endometriosis also can cause emotional distress. That's why it's important to seek treatment if you suspect you may have endometriosis. Keeping a record of your symptoms can aid your doctor in your diagnosis. And finally, there are numerous products available at Lynchs Pharmacy in Douglas to assist you in managing endometriosis more effectively. To start with, we have numerous products to get you started on an exercise program, such as exercise balls, floor mats, weights, and various other items to get you started on a program that we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as painkillers, bath salts, magnesium, vitamin B6, milk thistle, and evening primrose oil. We also have light boxes, blood pressure monitors, blood sugar monitors, and body fat monitors and assisted living devices. So that brings this video to an end. Customers of Lynchs Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your knowledge and understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing endometriosis with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynchs Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.